Okay, it's now 7 o'clock Eastern Standard Time, actually daylight saving time. Welcome to the July session of the Virtual Tumor Board from the American Head and Neck Society. This is a joint session between Curriculum Development Service and the ATC, and also the young physicians. We are very excited to have a different session, and we have guests that really need no introduction. Our case presenters today, which is a little bit different, are Dr. Samantha Tam from Henry Ford Health and Dr. Andrea Ziegler, assistant professor at Loyola University. Our panel discussants are Dr. Jeffrey Myers from MD Anderson, Dr. Lisa Schneider from University of Kansas, and Dr. David Cognetti from Jefferson. We also have Dr. Don Veet, the chair of ATC, and Dr. Vivian Wu, the chair of the Young Physicians, joining us. Warm welcome to all the fellows. Welcome to the family. It's going to be an exciting year. The fellowship year is one of the best years of your life. It's going to be long days, but it's a very short year. You're going to leave with fun memories, and you're going to have a great time. It's a fantastic profession that you have chosen, and we are here to welcome you and help you as much as we can. All right, let's get it started. Andrea or Samantha, who's going first?
Sure. Thanks so much for the introduction, Dr. Gibby, and we're excited to be, I guess, kind of the springboard for a lot of discussion. And just as a warning to the fellows that are joining here, I don't think me or Andrea have any of or all of the answers to any of these questions, but happy to kind of share our journey to tell you what we've done and hopefully to inspire some discussions. And Andrea, please feel free to pipe in whenever. So me and Andrea put together a slideshow that kind of goes through both of our journeys hand in hand. And we decided to do this in a little bit different of a way where we'll talk about, I'll talk about kind of my experiences and Andrea will talk about her experiences through some of these topics here. So our experiences through fellowships, our experience while we're looking for jobs, and then a couple of pointers on early career building, as well as some general advice. So to get ourselves started, Andrea, I'll let you start with introducing yourself.
Thank you. So I'm Andrea Ziegler. Just a little bit of background so you know where I was coming from. I'm from a mid-sized residency program in the Midwest. Came from a program without any fellows. And then I did fellowship at a pretty clinically heavy head and neck ablative and micro fellowship, also in the Midwest. And I was looking for a clinically focused job in academics during my job search.
So Andrea, before we go further, how did you decide on your fellowship? What were the factors that you were looking at?
So I wanted both ablative and micro. Location wasn't a huge factor for me, but just more clinically focused, I think, than academic or research focused, and very hands-on, sort of independent learning. Okay.
Do you think that because you guys didn't have a fellowship at your program, was it an advantage to you or was it a hindrance?
I did a little bit feel like it was an advantage. Obviously, not to knock fellows, I was a fellow, but that meant when I was the chief resident, I got to do micro. So I came into fellowship having some experience with sewing vessels and harvesting flaps, more so than I think I would have possibly had if I was at a residency with fellows.
Okay, let me ask Dr. Cognetti. David, when you're looking at the fellows applying, the applicants to your program, do you have any preference if they're coming from a bigger program, a smaller program, coming from East Coast versus West Coast versus Midwest?
No, I don't think size of program. I think obviously one of the things that we emphasize is we want people to come in with appropriate surgical training and readiness for fellowship, which I think is accomplished in just about every program in our small specialty. It's important that when fellows start, they come in and as soon as possible are differentiated from residents. They're not here to remediate their residency. They're here to gain the fellowship level skills. I'm laughing at Andrea's story because when I was a resident, Jefferson had no fellows. And we used to brag to the resident applicants and be like, we don't have fellows. We're like, you know, as chiefs, we're fellows. You should come here because it's such a great surgical experience. And then I went to my fellowship where there were like 6 fellows. I'm like, oh my gosh, what do the residents think of me when I show up? And probably a lot of people on the call tonight are having that experience when they show up. And one of the chief residents that I met with said something very good that really resonated. He said, look, fellows for the most part are big added bonus. As long as they're not here to remediate their residency, they bring in an outside perspective, they add teaching, they add a little buffer and all of that. And I can tell you, since we started fellowships at Jefferson, they've been a big plus to the structure and experience.
Perfect. Dr. Schneider, so you are in the Midwest. How do you, what are your preference, your program preference for the applicants? What applicants do you look for?
I agree with Dr. Cognetti. I don't think it matters whether the future fellow is coming from the residency program, which is big, or the residency program, which is small. I actually found one of our excellent fellows was coming from the program where it was 1 resident per year. So they did so much, they did everything. So
Okay.
we have absolutely no reservations if fellows come from the residency program, which is 1 resident per year, much smaller than ours, which is, for example, 4 residents per year. It is certainly helpful if the residents are familiar with, know how to do the bread and butter head and neck cases. I think my account might be slightly different from Andrea's or from Dr. Ziegler, so Dr. Cognetti's, because I think that if the future fellow comes from the residency program where there are fellows, if there are good fellows, that they know the relationship, they understand the teaching relationship and how to make it beneficial for residents. But either way, I don't think we have any preference when we select a future fellow.
Great, perfect. Okay, so Dr. Myers, the fellows coming D and D Anderson. What are you looking for when you are, as a group, looking for the applicant?
We're looking for Dr. Tam, and we got her. But no, Samantha was a fellow with us, and she was excellent. But she embodied a lot of the qualities that we look for in a fellow, and that's why we chose her, and she matched, and she was a phenomenal fellow. But there are a couple things. I don't think we have that criteria of better to have fellows or not, or a huge program. I think we really select the applicant, and a lot of it has to do with what they want to get out of their fellowship. And we offer different fellowship tracks. We have one position that has micro, but the other 3 fellows won't get micro training. And that has pros and cons. I think a lot of positions now, faculty positions, want people who are micro trained. So, we lose out on some applicants for that. But really, we want people that want to train not just in head and neck surgery and doing the operations, but in understanding the role of a surgical oncologist in coordinating multidisciplinary care. And that's both for the oncologic and quality of life aspects. So those are the major qualities we look at. Of course, we want people overall with some academic interest, though we do have fellows that move on and go into practice and are more clinically focused. So I think that about sums up what we look for.
All right, thank you. Andrea, continue.
So I'll just talk a little bit about myself. So I have a bit of a different background. I trained in Canada. I am fully Canadian, did all my training there at a mid-sized program for Canada. I came out really wanting to do a lot of research and had a dream to do a master's during my fellowship. And so that's what I was looking for in a fellowship. I went to an ablative only clinical fellowship at a larger academic center, MD Anderson, in the South, that also had opportunities to do research as well as a master's program. And what I was looking for at the end was a research heavy position in an academic environment.
Very good.
So our next thing that we want to talk about was fellowship. And so one of the things we talked about was, how did we think as fellows, that what we could have done to make the most of our fellowship. Andrew, did you want to start again?
No, you can go first.
Okay, sure. So a couple of things that I thought that, coming out of residency where you're, the chief resident, you're the go-to person for the staff a lot of the times, I thought that one of the things that I really learned was to approach every learning opportunity with humility. You might think that you know it one way, but it's really, this opportunity is a year for you to learn from the people around you, and to just, take advantage of every opportunity to learn. I really felt that there were a lot of opportunities that were kind of outside the box to learn, learning from radiation oncologists and medical oncologists, thinking about the multidisciplinary team that was really important during my fellowship. And these are opportunities, I think, to understand how things work at different centers and understand how different models of care are. One other thing that I felt was really important was to be really reflective of your experiences. It's a year, it goes by really, really quickly. And sometimes it's easy to just experience the year and let it wash over you. But there, when there are times where things are going, there's like bad outcomes, or when things are going well, I think it's really great to think back in terms of what went well, what went wrong, so that you can grow with those relationships and grow with those experiences. And I think it's important to do that while you're in your fellowship, not only afterwards, because that's really when you figure out where your gaps are. And then the last thing I have here is paying attention to the small stuff, because those are the things that we take for granted. So, there are some things like, when to do the surgeries or how to do the surgeries that are things that we all look into learning during our fellowship. But there are small things like how to deal with difficult patients, how to deliver bad news, all those types of things that I think are very important to practice coming out of fellowship. Okay,
Andrea?
Yeah, I mean, I agree with everything you said. There's always something to learn, even, in small cases that seem like they're straightforward, maybe not a challenging case. I felt like I was always asking questions. What would you do if this was the situation we were in, or XYZ? Because the next time you see that, it might be your patient, you have nobody else to ask. And so I tried to ask questions at every turn. And I feel like when you start clinic, or start fellowship, you want to just do as many flaps or as many cases as you can, but clinic is huge to go to in fellowship, and really make sure you understand the workup and what patients look like at 2 weeks and 4 weeks post-op, so you know what's normal. You can't always be in the OR, because that's not going to be your life after this. And then I thought it was important, again, I came from somewhere without fellows, and like Dr. Schneider said, I didn't completely understand that relationship starting out, what the role of the fellow was. When was I more junior faculty and supposed to be teaching, and when was I just supposed to be quiet and be the fellow in the back? And so learning how to teach so that when you're done with fellowship, you can get residents or fellows through a case smoothly is not something that you always learn during training, and something that you kind of have to figure out when you're done.
Yeah. So let me ask the panel, Lisa, when we are in fellowship, like the day that you have to go to clinic is like the day you go to prison. Like nobody wants to go there. It's like as if, you're thrown out of the classroom. So why is it important for the fellows to come to clinic?
Well,
yeah, go ahead.
I was going to say that a big part of the fellowship, a big part of the being a good fellow is actually showing up, believe it or not. Like many other positions in life, a big part of it is just showing up. So it is extremely important, as Dr. Ziegler said, that you understand. And I know all the residents and all the fellows go la 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 when we start saying that it's important to learn who to take to the OR and who not to take to the OR. And it is very important to understand the complications. And many times the patient looks great the first 7 days post-operatively, and many complications, fistulas, and wound dehiscences and abscesses and plate exposure and bleeding and you name it is going to start afterwards. So if you don't see it, how are you going to deal with it when you are in your own practice? So that importance of the clinical judgment and preoperative management and postoperative management, this is your year to learn it.
So David, Jefferson is super operative heavy, as we all know. Why is it important for the fellows to show up to clinic?
Bob, you know, I'm going to change your question a little bit and say, not just show up for clinic, I will say outside of the operating room experiences, because it goes well beyond clinic. It's showing up for the conferences, the tumor boards. We have a specific preoperative conference where we go over our cases. It's being part of the rounding and seeing the decision-making and the pathways that are developed to get patients through the continuum of care. So, you know, here it is July, the fellows on this call, I'm sure, are super excited to dive in the operating room, start doing the stuff that they didn't necessarily get to do as residents. But it reminds me of something Jonas Johnson said to me. He said, surgery is the easiest part of the job. And I still don't quite fully believe it. And I thought, all right, easy for you to say when he said it to me. But most of us with experience know that now the things that keep us up at night are the decisions that we have to make or some of the less than ideal outcomes that we deal with, et cetera. So I think it's really, really important to be fully immersed in the decision-making process, be challenged with making the decisions, and that stuff by and large takes place outside of the operating room.
Oh, Dr. Gibby, I think you're muted.
You're muted.
Sorry, Dr. Myers, I think you're famous for the fact that your patients love you. I'm taking care of one of them who moved to New York and she still talks about you. So why is it important to go to clinic?
Yeah, well, thanks for that nice feedback. But I think it's important for a lot of reasons that were stated. And I think, establishing the relationship, a lot of times these are, hopefully long-term relationships where you meet people and gain their trust. We had a patient last week, and it was the last week of the fellowship for the graduating fellow. There was a patient who came in that really was not that interactive, and his sister was there with him and spoke for him mostly. And, from years of doing this, you recognize the patient was in pain, he was malnourished, and he just had a lot of needs that he couldn't even attend to in talking about the diagnosis and treatment options. So we admitted him and kind of got him situated, working on getting him in a positive nitrogen balance, and we'll bring him back and have those discussions. And I think, that's one example of the kind of thing you learn with experienced clinicians that, takes years to see and develop. And by being there and being involved in, multidisciplinary decision-making, knowing what types of imaging studies, staging, how to do the endoscopies, those all make, a big difference in the training. And I think at the end, the long-term relationships and seeing how positive, so challenging sometimes, but that, I think those are all the important aspects. Yeah. And
so, Dr. Weed, I see you're on. You're the chair of ATC. What does ATC look for fellows to make sure they are graduating well? Is it the OR, is it clinic? What do the fellows need to do to satisfy the criteria to getting the certificate?
Well, so the fundamental answer to that question is we depend on the fellowship director to tell us that their fellows have met their criteria for graduation. What we require is of the fellowship directors and the fellowship programs. And one of the fundamental requirements for that, for the fellowship to maintain its accreditation, is that our site visitors see that the fellows are regularly attending an attendings clinic, not just their own clinic, which may or may not be general, may be head and neck, could be a mix, whatever, but really seeing and experiencing a clinic with the attending from an educational perspective. So at the end of the day, it's a broad operative experience. It's a true focus on head and neck surgical oncology and clinic experience, along with all the other conferences that Dave mentioned, which are, I mean, absolutely critical, is fundamental to the multidisciplinary surgical oncology training. That's what we expect. So when your fellowship directors, speaking to the fellows on the call, when your fellowship directors are telling you you need to be in clinic, it's not just them, it's us. We expect that, and we expect it for all the reasons that the panelists have mentioned.
Perfect, thank you. And then, I would add just to all the fellows that go to clinic and wait until you become an attending. And the first time you get a positive margin, and you're going to have that conversation with the patient. And then you will remember how your attendings talked in that situation, this difficult situation, when you have done your best and the outcome is not optimal. And it really helps you to have that perspective. All right, let's continue.
So I think we had a couple of questions for the panelists specifically.
Yeah.
I don't know if Dr. Gibby, you want to facilitate these.
Go ahead
questions.
and ask them.
Sure. So the first one was, what do you think makes a good fellow or a successful fellow? I guess on the top of my list here, I have Dr. Cognetti there.
Okay, David, what makes a good fellow? What makes a great fellow? I hope your fellow is not right here right now.
I don't know if our fellows are on yet. I guess it's too early to tell. So maybe they can hear my question and they'll see. I think what's really great about fellows is they come in with this sincere interest in our subspecialty. And right, so what makes a great fellow is somebody who's really engaged and eager to learn. So first and foremost, and so will even push us to try and do things beyond the standard everyday of what we're used to doing. Number two is they need to be a good team member. They need to understand that this is a team sport. So within the division department, as well as in the multidisciplinary forum, they need to understand how important that is. Number three, the educational piece. They're not just here to learn, they're here to teach. They need to have that good relationship with the residency and appreciate that that's of mutual benefit. I think Dr. Schneider's talked about that a few times, and I strongly agree. I tell my residents and my fellows that probably my best friend in the field was a chief resident when I was a fellow. And if you're lucky enough to be matched with a resident who's interested in head and neck, you guys, you can really hit it off and with mutual interest. So you have to be a teacher. And my last point on that will be, I tell them that teaching is the highest form of learning. That if you go through the year and you're able to teach, you are gaining an experience in doing so.
Okay. Dr. Schneider.
I completely agree. I certainly think that this we've been fortunate to have only great head and neck fellows in our program. And this is somebody, the great fellow is somebody hopefully who already has a very good facility with head and neck cases, somewhat familiar with micro at least, somewhat familiar with robotic at least setup that would definitely propel them forward and make them a good teacher for the residents. Certainly teaching component, as Dr. Cognetti has said. And I think it's very important to have a personal sense of responsibility and a sense of ownership. And that, again, is something that you cannot teach. And you either have it or not. And I'm happy that most of the people who go into the head and neck fellowship, they have that. And again, someone who is interested in teaching, interested in research, quality improvement, who always approaches their activity critically and has an intellectual curiosity to learn from each day.
Perfect. Dr. Meyer, what makes a great fellow?
Yeah, I think it's a really good question. I think these other leaders have pointed out a lot of really great qualities, and I don't have a whole lot to add, but I would say that, in the years that I've been doing this, it sort of evolved from early on, really wanting academically accomplished people that wanted to go far academically, and I think over the years, it's been, we still want, to train academic leaders, but I think for the fellowship, we want people to put the patients first, number one. It's sort of hard to tell that, but sometimes that comes through by talking to the programs they came from. And I think Dr. Cognetti pointed out sort of the teamwork, people that are coachable and have high emotional intelligence and that can work with different types of staff in different settings, clinic, the floor, the OR, and the faculty. We have a big faculty and, one another. And over the last few years, we've had really successful teams of fellows because they work together to make sure that all the services were covered and and also to meet their training needs.
Perfect. Let's see, Dr. Weed, you're also have a very established program in Miami. What makes a great fellow?
I mean, all the things mentioned, but really just somebody ready to come in and hit the ground running. Fellowship is like drinking from a fire hose when it comes to the volume of learning that you are exposed to. It's very concentrated, but the volume is high. The advice I give to all of my fellows every year is, even if you're interested in reconstruction as much as surgical oncology, it's the surgical oncology and the ablative portion of what you will learn that will challenge you for the rest of your career. And you've got to be paying attention to everything. You can't fall into a trap of, I want to do 15 more fibulas because it's my fellowship year and I'm not going to have this training when I leave. You're going to get the foundation that you need in everything, but you have to pay attention to everything and be present, as was mentioned earlier. You just got to take every learning opportunity. And as Dr. Cognetti said, teaching is a great way to learn. And so your interaction with the residents is as important as what you're going to be getting from your attendings.
Perfect. I think this was the best summary of how to succeed in fellowship I've ever heard from all of you. This was fantastic. I wish I had this. Although I was probably beyond hope anyway. But anyway, okay, let's go.
So our next topic was looking for jobs. Dr. Ziegler, you want to talk a little bit about what your job search looked like?
Now we're getting to the real nitty-gritty. The source of all the anxiety.
Yes. So I thought I wanted to work in academics kind of from the beginning, but definitely more focused clinically than research. And honestly, I started looking for jobs even before starting fellowship, and I looked everywhere. So I looked at all the online listings where you can find job postings. I was looking in the back of the White Journal, word of mouth. I think it's huge, just hearing from your fellowship directors who might be hiring or looking. And then, I was pretty flexible on where I wanted to go, but there were some locations that I was more interested in. And I certainly did just cold call or cold email some programs to see if they were hiring or thought that they would be hiring or if they wanted to talk to me anyway. So I kind of looked anywhere I could find.
Okay, and what do you think that got you the most bang for your buck?
Probably word of mouth, honestly, more than anything. And we kind of wanted to touch on this from the panelists, but it does feel like sometimes job postings, there may already be a candidate in mind from word of mouth or knowing someone another way. And so sometimes you see a job posting, but they're not really looking, it seems like, and that wasn't as fruitful for me, online postings, as hearing from email or word of mouth that someone was looking for a new head and neck person.
And before Samantha starts, I'm just going to ask all the fellows that are on the call, you feel free to put any questions for the panel or for the presenter on the chat box, and then we read them for everybody. So if you have any questions, please let us know. Happy to answer. Okay, Samantha.
Yeah, so I wasn't as sure where I wanted to work after fellowship, either go back to Canada or stay in the United States. So I started maybe a little bit later, and also I had a very long fellowship. My fellowship was 3 years in total. So I started to look, I guess timing wise, about the same as Dr. Ziegler had started to look near the end of my second year of my fellowship and the beginning of my my last year of fellowship. And I probably relied more on that word of mouth and cold emailing. I did use some online resources like Indeed and LinkedIn. And just perhaps because of my visa situation, it did make things a little bit black and white at some institutions. So it did kind of narrow things for me early on. Yeah.
Okay. And how did you decide on the current position?
So for me, I was looking for somewhere where I would be able to be successful academically, so had some protected time. And the other big thing was that visa kind of situation. So knowing that my ability to apply for extramural grants might be limited due to my citizenship status, I was looking for somewhere that would be able to facilitate my my specific visa situation as quickly as possible so I could go for permanent residency. So that was a major consideration in my job search. I happened to have a family, but a very flexible family, so location wasn't as big of an issue. So it was really those top 2 points, I think, that were the deciders.
Okay, Andrea, how did you decide on Chicago?
It had a little bit to do with opportunity, the job here, future opportunities, and location. It was highly desirable on my list.
Okay. How many places did you guys consider seriously before you selecting your last one? 1, 2, 3, 4?
So I just finished recently, and so I don't know if this was similar to your experience, Sam, but I had a lot of early interviews that were just phone calls or virtual, and then proceeded to go to places in person, only that I was very interested in. So I actually only went to 2 places in person and talked about offers with 2 places.
Okay. What about you, Sam?
I probably considered, 4 places seriously, and pursued further discussions in maybe 3 places.
Okay, so I guess the point is for the fellows, it's not exactly like a speed dating. You don't need to have 20 offers and 10, interviews. As you can see, with a focused research, you can bring it down to a few spots. Okay, do you have the question for the panel, or should I go ahead?
Yes, we do.
Okay, perfect.
Yeah. So, this is something that Dr. Ziegler had brought up about advertising positions, and just from our experience, sometimes those postings that are on like Indeed or LinkedIn or Glassdoor and things like that are actually positions that are spoken for. So we wanted to ask the panelists, like, how do you advertise for positions? And when you advertise, you have candidates in mind, and in terms of fellows and applicants that are looking for jobs, how do you prefer for them to reach out, or how has that been successful?
Perfect. That's an excellent question. So let's just start. Dr. Myers, how does someone become an attending at MD Anderson Cancer Center?
Yeah, I think it's a really good question. And, for the most part, at least since I've been chair, we try to advertise for positions. And if faculty are tenure track, they have to go through a national search through our, office that, does searches, the chief academic officer. So, we have to advertise for a certain amount of time. There's some delay and that process takes a while. So we try to get the word out other ways, some word of mouth and some writing to program directors and telling them we have the positions available. We do try to follow the Rooney Rule and, have candidates that are, represent different genders and races, and have underrepresented minority candidates. And, that's something in our department, but also the institution and the state. And however, if people reach out, sometimes we have people that are our own fellows or outside fellows that reach out, want to talk about opportunities, and we're open to that. So either responding to positions or just calling on us and asking, we're happy to receive the interest. And if we have something, consider them. And if we don't, to just be upfront about it and say, we have kind of rigorous constraints with the institution when we want to hire, and it has to do with a number of factors. And when we don't have jobs, it's unfortunate timing doesn't always work out for someone we might be interested in, and that's part of it.
Okay, Dr. Schneider, how do you select new faculty?
So I wanted to also add a couple of points, maybe not directly answering your question right now. I think timing is very important. I think that actually right now is a great time to both advertise and apply for jobs, because academy is coming, it's going to be in person. So that's a great time to meet the future employers and to meet the future applicants. So I certainly echo what Dr. Ziegler said before, and even cold calling or cold emailing. And really, I know that you have a lot coming at you, that it's the first week in July, but if you want to meet with people at the academy, now is the time to hustle. I wanted to put a plug for a reconstructive sections app called Slack. And for those of you who are members of the Society for the Fellows, and most of you are members of the Society, and please sign up for the reconstructive section. And this is an app. You basically join the app, and it has various categories, including job posting. And I saw a new job posting actually today. So highly suggest that you look. How do we advertise? We certainly put an advertisement through the School of Medicine and through the institution. As Dr. Myers mentioned, we do the same thing. But at the same time, we also reach out to program directors. And as far as how do we prefer applicants looking for a job, email us or reach out. Email is probably the best thing.
Okay. All right, so Dr. Cognetti, you're a head and neck surgeon and you're the chairman. So basically you have the power of the sword and the power of the purse. How do you decide on selecting a new faculty?
Yeah, so in full disclosure, I haven't been chairman that long, and I've only hired one person thus far. And I could share a little bit about that story, but I think one word of advice I'd have for the fellows is, in your head, picture your ideal job, and then in your head, picture your ideal geographic location, right? Because this isn't training anymore. You're looking at a long-term commitment here. So both of those things matter. And then you have to decide how much on the job side are you willing to give up on to get your ideal geographic location, or how much on the geographic side are you willing to give up on to get your ideal job? Obviously, it's ideal if they both match, but you may be forced to sort of pick and choose a little bit there. I say it because all the other stuff, I won't overly rehash. Yes, most institutions have to advertise by regulations and equal opportunity for a certain amount of time. I think if it's gotten to that point, there might be some truth to the jobs already has somebody in mind. I think if it's a email out to the program directors, there's more likelihood that that's truly an open job. But I would suggest, if you have a particular program or city in mind, if you can personalize that email, that will carry more weight, because obviously programs want people who want to be part of them, right? We're very interested in somebody who would be happy here and be successful here. So it's pretty easy to tell if I'm the recipient of an email where they just removed Jeff's name and plugged in David, versus I got an email that says, look, I remember from the interview trail and so told me to reach out to you and blah, blah, blah. And I'm really interested in Philadelphia because I grew up in New Jersey. Like if that's truthful stuff, that carries weight.
Perfect. I see my partner in crime, Dr. Moore. Mike, Indianapolis is becoming one of the fastest growing cities, very desirable. How do you guys decide on a new faculty?
Yeah, I think for us, a lot of it is how, well, I think a couple things. One, how the person fits into the group. And that's one, personality. We rub elbows with these people for extended periods of time, every week. And so want to have a fun collegial environment, but also kind of how that person would complement what we're already offering, whether it's bringing a clinical skill set to the group that would enhance what we can already offer, an academic component, looking for a clinician scientist to complement an already busy clinical group. And I think a lot of it is it's centered on that. And then that's kind of the initial, if you will, kind of paper cut assessment, and then talking to references and stuff to get a sense on the person's background and interest. And then based on that, it's really as David had highlighted, having somebody really have a sincere desire to be a part of the group and be excited legitimately to live in that geography. I mean, Indianapolis is flyover country for many people. We love it here. And I think, you want somebody who's really going to be passionate about not only the group that they're working in, but also the environment where they're living. And so I think those are all a big part of it. And then, having kind of a rich multidisciplinary background is a big thing. A lot of the things that were already covered, the basic skill sets are important, but I think also how could they then fit into the group that's already here in a way that would be successful for them long term.
Perfect. Okay, Dr. Weed, Don, how do you get you people to Miami?
Well, it's interesting. The idea of posting positions, it's hard to hire. It's a challenge to get positions approved. And more often than not, we are reaching out and looking for people while we're simultaneously getting a position approved through the medical school and the health system. So we need to post positions, but it's a bit of simultaneous work ongoing. So it's not as much that positions are being posted and we already have a person in mind necessarily, but by the time a position actually makes it to the posting, that word of mouth search, which is a two-way street. In other words, we're contacted all the time. Do you have a position? Just as we may be looking at people that we know, if we're contemplating a position, we find people that we hire in any and all of those ways. So I would just highlight the fact that from the hiring perspective, it is challenging. So it's a challenging process for everybody involved.
Okay. Perfect. Thank you. All right. You guys have a next one?
Yep. So our next question was, how do you make yourself marketable for the job you want? And I mean, some things that I had thought about were kind of things that were already talked about, where are my priorities, understanding where I can be flexible, deciding in terms of location versus job opportunity, what is there. Though I will echo what Dr. Cognetti had said in that sometimes it's easy for us to think that why would anybody want to hire me? So I'll just take whatever job that comes. But I think that understanding what your dreams are and what your desires are is really important in this situation, because this is where your career is going to and where it's going to grow.
Okay.
Dr. Ziegler?
Andrew?
Yeah, so one of my attendings to residency always said the three big things you need are to be able, to be affable, and to be available. So I felt like I was very open when I was looking for jobs in terms of being flexible. So I was pretty open to going anywhere, and open to things that maybe weren't necessarily my quote unquote dream job for my first job. So I feel like a lot of new jobs that open up, you may be at a satellite once or twice a month that maybe isn't in the big city or in the big medical center. And I was okay with that. Maybe going to a VA hospital or a county hospital a day a week. And then when you are interviewing for these jobs, you're going to get asked all the time, what do you want your practice to look like? And for me, I certainly wanted to do ablative and micro, but I was sort of willing, if they had needs, to try to fill that gap. So if they needed someone else to take trauma, I don't love trauma, but I'll do it. If they needed somebody to do more endocrine or cutaneous stuff, I was certainly open to sort of any of those needs that they might have, that I could try to fill any gaps that they had.
Perfect. That was an excellent summary. Yeah.
I was
Okay.
just saying, maybe that wasn't good. Maybe people thought then I had no idea what I really wanted, but I was trying to make myself marketable.
No, I think this is great. And I think for all the fellows on this, so just to summarize, apply early, apply often, look at different routes, and don't be fixated. And really what I learned from you, listening to you guys, is like, know yourself. What is important for you? Don't bend those, but everything else could be flexible. And that just gives you more opportunity. And just enter it with a positive attitude. That Dr. Reed said, hiring a new faculty is not hiring a fellow. It's very different. You know, it's an investment about $250,000 for an institution and up. And it is, you want to make sure that you polish yourself to come across as that applicant, that candidate that's going to achieve that job, because the institution is, and the department and your partners are basically trusting you with their patients and with the practice, with the everything. So it's a big opportunity. And also you should consider yourself as an equal to everybody. You're not a trainee anymore. You are going to be an assistant professor or a senior surgeon. And that's, you do have a lot of leeway to decide what you want to do with your life. All right, so let's finalize. Is that your last question, this one?
We have, I mean, we have a couple of other ones.
Okay.
I mean, I think we talked about this part already, about why I chose my job. I don't know, Dr. Ziegler, if you want to talk about any kind of other points you have for this.
No, I think we kind of talked on it. And a point that has been made a lot, that if I heard it, I think at some point during my chief year, that your first job isn't necessarily your dream job. And I think that you just kind of have to accept, like everyone said, everything may not be perfect, but that doesn't mean that it's one, your forever job, or B, that it can't become your dream job. So if there's opportunities there for you in the future, it may not check every box the first couple years, but that's okay.
Okay. All right. Do you have another round of questions for us?
Yeah, these are some other questions for the panelists, just reflecting on their first jobs and what kind of experiences they had at their first jobs.
Perfect. Okay, so I'm going to ask this because I do know a little bit of background. Lisa, born and raised in, you were born in Ukraine or Russia?
Ukraine.
Ukraine. Raised in New York City, that I remember. Trained in New York City, went to Miami. And how on earth did you end up in Kansas?
It's a puzzle. It's a puzzle for everybody who trained me. I'm sure Dr. Weed is chuckling, although he has visited me. And but this is my job, my first job. I landed here after training on the East Coast and living on the East Coast. And I've been here for 16 years. And it is my dream job. So I'm just very, very lucky. I had a great job. How did I choose it? Based on people. first and foremost, for those of you who know my senior partners, Dr. Doug Girard and Dr. Terry Tsui, you understand why they're great people and great mentors. And I felt that it will be a great group and a great job. So head and neck is a team sport, as Carol Bradford said. So you certainly need to understand the circumstances and you need to understand people. One thing I wanted to add to what Dr. Ziegler said, when she said that understand the things that you want to be flexible on and understand what your deal breakers are. And the same goes to your significant other or to your family. Understand what their deal breakers are and what their flexible are, because if you are unhappy, if you chose to ignore red flags or your deal breakers, or your significant other, or you convince them to ignore their red flags, you're going to be unhappy and it will backfire. And 3 years down the road, you're going to be looking for a new job.
So Dr. Cognetti, how did you end up becoming the chair?
Yeah, this list of questions almost makes me feel unqualified to be on the panel, because I'm in my first job, which became my dream job, if you will. So I'm a little bit like Lisa in that I haven't left the institution that I started. You could add it a little bit. I also did my training here. I did my residency here. I left for fellowship, of course, and I came back. So what drew me back was my experience as a resident, the people. And what's kept me here is the people and the shared passion for our department and our growth. We're a very different department than we were when I trained. I often tell the residents, I wish I did my residency here, even though I did. And to Dr. Ziegler's point, the job that you start may not be the job that you end with, even at the same place. Like you have the power to grow and change things and advance things. And it's been a lot of fun to do that with the people that I've worked with for a very long time here.
Okay, so Dr. Meyer, there is another very famous Dr. Meyer up north, and you have a relationship, and somehow you didn't go back to Pittsburgh and you stayed in the MD Anderson in the South. So how did that happen?
Yeah, it's one of those things that just kind of worked out that way. But it was 26 years ago this week that I came to Texas for a one-year fellowship at MD Anderson and was planning to go back to the Northeast, and had some opportunities at a couple places in the Northeast, including Pittsburgh, and going back where I'd done my residency. And there was a lot that was appealing about it. As a physician scientist, Dr. Gephardt was the chair at the time, and he really placed a high priority on physician scientists, recognizing that, and the same is true today. We have a lot of patients that fail treatment, and we need to come up with better ways to stage them, diagnose them, treat them, rehabilitate them. And he had placed a high value on that. So I wanted to be in that place and said yes to the opportunity. And, here I am all these years later.
Yeah. So I'm going to ask a couple of people who actually know change job. Mike Moore, you were at UC Davis. How did you leave California?
Yeah, so I started at IU a while back, which actually was a great opportunity, and was actually very happy there at the time. I think my decision to go out to Davis was centered on my sincere love of Greg Farwell. He's such an amazing person, and I'd always talked about the possibility of work. It'd be great to work with him. And we had I actually had interviewed there when I came out of fellowship, and strongly considered it at that time, and just thought so highly of him and knew the department well just through that interaction. Geography, I had done med school in California, so I thought it would be a piece of cake. And my wife loves Napa Valley, so it wasn't a terrible sell, going an hour and a half away from there to work. But going out there were a lot of very good aspects about the job. The department was fantastic. being away from family was very difficult. I think when you're in training, it's one thing, but with a young child and aging parents that don't travel well, that was really what drew us back. And I was incredibly fortunate that a job opportunity opened back up at IU, and I had a ton of, great friends and colleagues there that I had the opportunity to come back and rejoin again. So yeah, kind of a strange story. Not normal to go, start at a place, go somewhere else, and then come back. But I will say there's not one step along the path that I regret. It's been a great journey, and I certainly couldn't be happier with the current situation. Perfect.
I see Dr. Vivian Wu. Vivian, if you can make a comment. I know you have changed jobs. What inspired you to go to these different places?
Hi there. Thanks for asking. So I started out in Virginia for the first 5 years after fellowship, and it was a great opportunity. I was able to work in a lab there, build up my research. But as as things go along, you start to realize what exactly do you want in your team. And when you leave fellowship, you might not know exactly what that is. But as you speak to other colleagues, other people who were fellows at the same time as you, and you hear what they have, you think, oh, maybe that's a better team. That's a better sort of flow for patients to go through. And ultimately, I ended up at Ford because I really think the multidisciplinary team there is broad, wide-ranging, and had a lot to offer. One other thing I wanted to add to Dr. Ziegler's comment about, oh, I'll do cutaneous, I'll do endocrine. I mean, I think that's one way to also build your practice when you're an early faculty member, is really to show up to those tumor boards, show up to the endocrine meetings, show up to the derm meetings, the cutaneous meetings, and say, hey, I'm here to help your group, and really build your practice that way. And so this second job has for sure given me the opportunity to do that.
Okay, you got 5 more minutes left. Andrea and Samantha.
Babak, I have a question for our panelists real quick. When I talk to fellows who are in training and I've asked them like what they're looking for in a job sometimes, a lot of times they'll say, well, I really want to do like a 50-50 research and clinical job and really focus on research. And so for Lisa, David, or Jeff, I think it's really important to think about when a fellow is really committed to the idea of a significant research component to their career. When you're considering programmatic growth in your department or division, or depending on your setup, what kind of things would you look for in an applicant to fill that kind of position? Because sometimes I feel that applicants, like I know you're trying to balance a margin versus mission many times in the positions that you're in, and if you have a commitment to develop a mission-based practice. I see a lot of fellows who just they like the idea of 50-50, but I think it's important to articulate what are the kind of things you would want to see on an application for that kind of position that would be successful.
Okay, good question. Let's see.
Thanks, Jeff.
I'll take a stab at it. Yeah, thanks for that question, Jeff. There are a couple of perspectives on this idea of hiring a physician scientist or clinical investigator that's going to be in practice and balancing that. And I think one of the things is for the applicants, I would just say, find a place that has a track record of doing that, because we've trained a number of people who've gone out into the world to pursue those positions, and there are places where they've done it at lots of times and helped people get grants and clinical trials or whatever kind of research they're doing and be really successful at it to protect their time. There are other places where they like the idea of it when you're applying, and maybe it's a small department and you end up doing a lot of other jobs that take you away from the research. And that would be a recommendation for the trainees or the fellows looking for those kinds of jobs, and talking to people who've done it before. And there's an ever-growing number of them, people like Del Yarborough, Bob Ferris, and Jim Rocco, and others around the country, and seeking them out at the meetings or emailing them and talking about it, and getting their advice, because it's hard to balance all of it. but anywhere, but you'll be most successful in a place that understands what you bring and what you need to be successful, and being patient. That it, you know, some people say, well, we invested 2 years into you and you didn't get a grant, and it can take longer than that. It took me longer than that, and you sort of have to be patient, encouraging. And more to the question that you asked, I would say, you know, looking at people that have a track record of publication, who their mentors were, and a clear idea of what they need when they get there. Further mentorship. You know, generally, after clinical training, if someone's had a lot of research experience coming out of residency and fellowship, they need to sort of retool. Things move fast, and they need to kind of learn what's the latest in immunology or targeted therapy or genomics. That all of that moves quickly, and it's important to have a realistic vision about what it takes.
Thanks.
Thank you. It's 8 o'clock now. So any last words? First are from our presenters.
And yeah, no, I think that was a really great discussion. It's really great to hear everybody's experiences. So I guess in terms of last word, just to the fellows, if there's any other questions or anything like that, happy to answer them. Just feel free to reach out.
Perfect. Andrea?
No, agreed. Same. I hope
Okay.
that was helpful.
Thank you. Lisa?
I wanted to make a comment kind of along the lines of what do you regret? I don't think I regret anything, but if you ask what I wish when I was looking for a job, I understood things such as what's required to build a multidisciplinary program in head and neck cancer beyond just the physicians, and understood the different components a little bit more appropriately. And I also wanted to put a plug for Dr. Brian Burkis and Sharuk Jalisi on economic impact of head and neck oncological surgeons. I usually send it to all the fellows. It was published in Head and Neck in 2014. And it really helps you understand what you're worth to the institution when you're looking for a job.
Perfect. Yes, I love that piece. David?
Yeah, I just like to add a few words of congratulations and reassurance. So congratulations, you've picked an outstanding specialty. And what I mean by that, it's full of people. I don't know why my camera keeps going off, but it's full of people who are very interested in your success, whether you end up at their institution or not. And so you will have support, and make sure when you seek out jobs that you do have the support of the people you're joining. And number two, reassurance is people are very worried about the job market and the number of fellows. I've seen fellows get jobs before they started fellowship. I've seen fellows get jobs in May and thereafter in fellowship. They're out there, the opportunity will show up. You're all gonna land somewhere and have successful careers.
Perfect. Dr. Myers?
Yeah, I don't have much to add to that. This was a great
Okay.
session, and you know, thank Dr. Ziegler and Dr. Tam for you know, bringing such good questions to us, and you know, painting a picture through this hour of, you know, what it's like and how you can maximize the opportunity this year. And you know, you're just starting, and I hope you all have a wonderful year. And you know, as Dr. Tam said, reach out to any of us, mostly by email. We're happy to talk to you.
Perfect. Thanks. Don, any word from ATC? Any last word?
Just welcome everybody, echo the words of encouragement. You will be hearing from us about a meeting. It'll be a call probably, maybe Zoom, I'm not sure, but sometime in August as essentially sort of an ATC orientation to the fellowship year after you've all had a chance to kind of land, get your feet wet in your institutions.
Perfect.
So,
all right. Absolutely. Thank you so much. Thank you, everybody, for joining us. This was a fantastic start to the year. Ask us any questions. Welcome. This is a fantastic specialty. This is a fantastic life. Don't worry about anything. Be active, but don't be anxious. Our next session is going to be on August 3rd. It's going to be challenges in oral cavity at 7 p.m. Eastern time. I hope I see you all there. Thank you again for all the panelists and all presenters, Dr. Samantha Tan, Dr. Andrew Ziegler, and our panelists, Dr. Lisa Schneider, Dr. Jeffrey Myers, and Dr. David Cognetti, and also my friends, Dr. Michael Moore, Jeff Liu, Vivian Wu, and Dr. Don Beat. Have a great start of your fellowship. I'll see you next month. Take care.
All right,
Thanks,
good to see
Vivek.
everybody.
Good night.
Thanks,
Great
Beth.
session.